This is a lesson on OCD. So, if you go onto Teams, you should be able to access this PowerPoint and you should be able to go through the PowerPoint in your own time, following what I've talked about today. So if you want to click on those two YouTube clips, they should give you an idea as to what OCD is. You may know this already, but if you want to have a look at those, it should give you some help. Okay, so the objectives for this lesson, it's a short lesson, are to explore behavioural, emotional and cognitive characteristics of OCD. Right, so first of all, you're going to need a clear definition of what OCD is. So OCD stands for Obsessive Compulsive Disorder, and it is part of the serious anxiety-related disorders. So it's classed as an anxiety disorder. So it's characterised by somebody who experiences frequent, intrusive and unwelcome obsessional thoughts. So what does this mean? This basically means that somebody cannot get thoughts out of their head. It's intrusive. Intrusive means it takes over. You can't stop it. And then those thoughts are often followed by compulsions, and they are the impulses, urges to carry out a behaviour to reduce the anxiety. So the compulsion, so for example, the obsession could be thinking your hands are dirty, and the compulsion would be I have a compulsion to wash them. So an exam tip, first of all, you need to ensure that you are very clear that you can distinguish between the two. So an obsession is a cognition. A cognition is a thought. That takes place in your mind. A compulsion is a behaviour, which is something that you actually do. Please ensure that you are able to distinguish between the two. And if you have a stem, just make sure that you look at what is the person doing. And that will always be the compulsion. Are they praying? Are they exercising? What are they doing? Because that will be the compulsion. So usually it's easier to work backwards. Again, there's a little clip there that you can click on to follow and have a look at. Okay, so symptoms, diagnosis. So obsessions, what are they? There's some key words in there, and if you're asked to define what is meant by obsessive compulsive disorder, I would want to see some of these key words. They are persistent, recurring, unwanted thoughts. And the other thing is, they are usually irrational or unrealistic. So it's okay to have persistent thoughts about something that's completely rational, but the fact that maybe your hands are constantly dirty or contaminated by germs is irrational. And it's also unrealistic because obviously in our society we live with germs and bacteria all the time. So this is persistent. That's a key thing because it keeps happening. They're unwanted, they're intrusive. It's something that actually takes over you. The compulsions, again, there are two key words in there that I like, repetitive and ritualistic. So repetitive and ritualistic behaviours. And the key thing here is this is what you actually do. So for example, if your obsession is that you're contaminated by germs, one way that you might relieve that is to engage in a repetitive behaviour of washing. So please ensure that you know what the obsession is, i.e. the obsession is the thought about something, I feel I'm dirty, and the compulsion is the behaviour of I'm washing. If you notice, there's a key thing in the middle there where it says the ritualistic behaviours that reduce the anxiety. So we're actually bringing in some of the emotional characteristics there as well, which I'll talk about in a second. Okay, so this is a little bit like a vicious circle. So we've got the obsessions, and as you can see, the obsessions lead to anxiety. So we'll just take the image at the top of the guy. You feel that you're dirty, you feel that you're contaminated, that you're full of germs. That is an obsession. It's constantly coming into your head. It's intrusive in your thoughts. That leads you to feel anxious. So it increases your heart rate, it makes you feel clammy, it makes you feel dirty, you just don't feel relaxed. Therefore, the only way that you can relieve that anxiety is to carry out a behaviour, which is the compulsion. So the compulsion would be to go and wash your hands, but probably not just to wash your hands once, but to do it, I'm using keywords, ritualistically. So to continue washing your hands over and over. What does that do? It provides relief, and therefore it reduces the anxiety. And as you can see, that's okay, but it's usually short-lived, because then the obsession comes back. Okay, so as you've done for the other two disorders, we now need to have a look at the cognitive, emotional and behavioural, and that's how I prefer to look at it, because the cognitions, your thoughts, lead to feelings, which are emotions, which lead to behaviour, which is obviously what you do. So make sure that you know what the characteristics are. So what you think are the cognitive aspects, what you feel are the emotional, and what you do are the behavioural. So we just go back to this. So here are a few of these. So the cognitive, they are the obsessive thoughts. And you can see there's a couple of terms. Selective attention. That's where your attention is constantly directed towards whatever it is that is causing you anxiety. The emotional is the anxiety. Now it could be depression, but in OCD it's more likely to be anxiety, because it's more likely to be increased heart rate and so on, etc. And that would eventually lead you to behave a certain way, so repeat doing something again to reduce the anxiety. 3 exam questions there. I apologise because I've just copied them across and they do say phobias, but they should say OCD. Please ensure that you are able to outline the emotional, behavioural and cognitive characteristics of OCD. I would advise for the 3 marks, if we want to do it by numbers, 1 mark for identifying what an emotional characteristic of OCD is, another mark for explaining that, and another mark for giving an example. Please can you ensure that you're able to do that? I will be setting some exam questions next week on this, and I want to ensure that you're okay with knowing the difference between these, so please contact me if there are any queries on this. Thank you for watching the video, and you should be able to watch it at any point if you might need to for revision.